Welcome, everyone. Today's topic is extremely important because it addresses one of the most common modern diseases, high blood pressure, hypertension. In the past, this illness was considered a problem that only affected the elderly. But today, the reality is different. Even young adults in their 20s and 30s are already suffering from it. What is normal blood pressure? When blood pressure is measured, for example, you might hear 120/80. The number 120 represents the force the heart exerts to pump blood throughout the body. The number 80 is the pressure of the blood returning to the heart to nourish it. The normal range usually falls between 110/70 and 120/80. Any significant rise or drop can lead to serious health problems, such as weakened or failing heart muscle.
Main causes of high blood pressure. 1. Insulin resistance. When consuming large amounts of starches and sugars, the pancreas secretes insulin to move sugar into the cells. Sometimes, however, the cells refuse to take it in, so sugar remains high in the blood, while insulin continues to be secreted in excess. This causes inflammation in the blood vessels. Cholesterol then deposits to repair the damage, narrowing the vessels and raising blood pressure. 2. Electrolyte imbalance. The balance between sodium and potassium is crucial. Too much sodium with too little potassium causes fluid retention inside the vessels, making the heart work harder to pump blood, thus raising blood pressure. 3. Stress and anxiety. Chronic stress increases the hormone cortisol, which in turn raises adrenaline levels. This makes the heart beat faster and stronger, elevating blood pressure. 4. Excessive use of painkillers. Frequent long-term use of painkillers significantly increases the likelihood of developing high blood pressure.
Treatment. How can we control blood pressure? The golden rule: if you know the cause, you can treat the problem. The first key to treatment is diet. A diet known as the DASH diet, dietary approaches to stop hypertension, has been developed, and it is one of the most successful approaches for treating high blood pressure. Features of the DASH diet: lowers blood pressure by 10 to 14 millimeters in less than a month, relies on adjusting eating habits rather than medication, balances different nutrients effectively. Daily dietary components: grains and starches, 6 to 8 servings. Quarter of a loaf of whole grain bread equals 1 serving. 4 tablespoons of rice or pasta equals 1 serving. 1 medium potato equals 1 serving. Vegetables: 4 to 5 servings. 1 salad plate equals 1 serving. 1 cup of cooked vegetables equals 2 servings. Fruits: 4 to 5 servings. 1 medium fruit equals 1 serving. 1 cup of fresh juice equals 2 servings. Low-fat dairy: 2 to 3 servings. 1 cup of skimmed milk equals 1 serving. 1 container of low-fat yogurt equals 1 serving. Protein: up to 6 servings daily. Grilled chicken breast equals 3 servings. Grilled meat the size of your palm equals 2 servings. 1 can of tuna equals 3 servings. Legumes: 4 to 5 servings weekly. Examples: beans, lentils, chickpeas. Healthy fats: 2 to 3 servings daily. 1 teaspoon of olive oil or peanut butter equals 1 serving. 4 to 5 servings weekly. Very small amounts, preferably after a full meal to reduce their impact on insulin. Salt: limit as much as possible. No more than 1 teaspoon daily.
Sample daily plan. Breakfast: 1 boiled egg plus low-fat cheese plus 1 cup skimmed milk plus 1 fruit plus salad. Snack: 1 banana or apple. Lunch: 6 tablespoons rice or pasta plus quarter of a grilled chicken or a piece of meat plus large salad plus vegetable soup. Snack: a handful of unsalted nuts. Dinner: low-fat yogurt plus 1 fruit plus salad. Additional guidelines: exercise for 30 minutes daily, brisk walking or light workouts. Drink at least 2 liters of water per day. Avoid smoking completely. Stay away from fast food and saturated fats. Maintain mineral balance in the body: potassium, magnesium, protein. Conclusion: high blood pressure is not limited to the elderly. It has become common among young people due to unhealthy eating habits and stressful lifestyles. By following a healthy diet such as the DASH diet, exercising, reducing stress, and lowering salt intake, Blood pressure can often be controlled naturally, without relying on medication in many cases.